Good morning, YouTube. Good morning, YouTube. Don't mind your girl. As you know, your girl is in nursing school and giving updates. Had clinicals yesterday. As you guys may not know, I am in Med-Surg 3. So my next term would be my last term. I will be capstone. I have 3 more weeks until capstone. So, Med-Surg 3 has been great. As you guys can see, my eyes are a little irritated. It's this season. I think it's allergies. Because using I put the Visine in it, it does clear it up. But it comes right back. And, also I had the ombre. I got my eyebrows done. They've been done for about a month or so now. Was it a month? Did I get it done in September? Shit, I don't even remember. I think I got it done in September. I'm not sure. No, I got it done in August. So this is called ombre. I have to go back for a touch-up next month in October. Oh, my eye. I'm sorry, y'all. But it's just updates. School, everything is going great. Passing everything. Med-Surg 3 is a little bit challenging. I feel like I am stepping up to be a leader when it comes to running the sims. And I think it's because the cohort that I'm with now compared to the first cohort, I'm not gonna lie, those some bad, you know what, they was very strong. A lot of them have direct patient care, EMTs, MAs, like you name it, they got it. The group that I'm in, I think only 1-2 may have direct patient contact. I don't really have patient contact, but I've been getting a little exposure since I transferred to this new hospital. I still do tele. I did quit my claims adjuster job with injury because that job requires a lot, and it did pay well. Shit, I was making just as much as I'd be making when I finished nursing school. So everything's going great. Like I said, Med-Surg 3, I've started a couple of IVs, and that was one thing I'm like, how do you guys know how to stick the person? So I still need some more practice. I'm not gonna lie, I still need more practice. I haven't done a Foley yet. I deal with a lot of medications, you know, sub-Q injections, narcotics. I'm passing meds, you know, the works. I really enjoy, and I really enjoy doing this. A lot of people say, you know, that it's hard. They cry. I'm good. Because my thing is, what you put in is what you're going to get out. So you just have to be serious about it when you do decide to, you know, pursue this route as nursing. I can't believe I'm close to the end, you know, with just the things that I've gone through when I started nursing school. You guys may not know, but I started nursing school going through a divorce. And a lot of the instructors, they tell the nursing students, if you're going through a divorce, you need to wait till after you finish nursing school and then go through it. No, I went through it while going through nursing school. And I think that was actually one of the best things I could have done. Because of the fact that it pushed me harder. It made me work harder. It made me study hard. Like, I've been in school, I never had to study and I can pass. I never had to put a lot of work in, I can pass. But I could tell you, just the things that I was going through, it did push me real hard. It did motivate me. So it was good for me to go through it. Even when I was talking to some of my mental health instructors, and, you know, they was talking about, because one of the other ladies in my class, you know, she was going through divorce and she was having a hard time. You know, she wound up failing the class. She wound up dropping the class. So, you know, and I know it's tough, but you just got to have a certain mindset. You know, life still goes on. The sun still rises and set, you know, so you just have to just, you know, put that energy and just make it all positive is what I've been doing. Even with job offers, I've been, like, anything pretty much I apply for, any exam certification I completed, I passed, no problems. So I feel like, I had to go through all this to get to where I am right now. Another thing, my tuition is paid in full. So I don't have to work hard to try to, pay my tuition, because as you guys may not know, I didn't qualify for grants and I didn't qualify for loans. I wasn't trying to get a private loan. So I paid my tuition out of my pocket. Tuition was very expensive. As you guys know, I did go to a private university. I really enjoy. I know they have, every school gonna have their ups and downs or whatever. And I think a lot of people expect for private schools to be perfect because you're paying all this money. And I get it, but it's not gonna always go the way you want it to go. And that's just all a part of life, But I really enjoy the school I went to. I'm going to, I guess you can say. But my last day of class would be January. It'd be actually a few days after my birthday. So I'll be taking my final, and I'm so glad, because after I don't know how the class is going to be, because I know one of the ladies was telling me, who's in the cohort right now, she was just saying how it's just a bunch of exams and stuff like that. But your girl is ready. Not pink eye. I'm gonna put some Visine. I actually went and brought me some Benadryl. And as you guys can see, my hair is getting so long to the point where now I have to start pulling it back when I do my clinicals, because I don't like it getting in my face, especially when you're dealing with a lot of things with the patients. Because let me tell you, my ID being on this long string, I don't like that either, because it dangles. And when it dangles, it could dangle into something else. It didn't dangle well, it still was bad for me, because I don't want my ID touching anybody underwear, and my ID actually touched somebody underwear. So of course I cleaned that mother sucker off, but I don't know, I feel like at first, I'm still nervous. Right now, I'm starting to complete application for residency. Don't know what my specialty is, but my strength is cardiac. And that's because I've been doing tele for 27 years. The hospital that I just transferred to, I love it. I love the fact you don't find floors where they have, nurses that get along. They have a great team. They work well together. They help each other. And not gonna lie, it's not a specialty. It's an observation unit, so the patient kind of comes and goes, and I kind of like that too. You have 5, 6 patients. 6 is the max I can have. I really didn't want to come out of school dealing with that many patients, because I know I have very poor time management. I know that's one of my weaknesses. But I think once I get in, start doing it, I'm gonna be fine. But if I don't get that position, I'm looking at critical care. Because I believe I really would do well. I think it will also open up a lot of doors for me. And it's kind of like I'm trying to figure out, do I want to go somewhere where I don't know the people? And I know how it is being a new kid on the block. And the person I am, anything comes, I check. If any type of situation, issue, any type of negative comment I feel, I address it right then and there. I cut that stuff short, because even at this new job that I'm in, I guess they look at me being a new person, they could just talk to me any kind of way, or they think I'm supposed to be yes ma'am, yes sir. That's not who I am. So I know a lot of them don't like my black ass, and guess what, I really don't give a damn either. But yeah, I have to check some of them. Even some nurses, they thought they can come at me, and I nipped that bug quick. You hear me? And like I say, like some of the other texts, they was like, oh, you know how to handle. Yes, I do. I've been doing this for 26 years. I already know all how they do things. And that's another thing of kind of like what I'm looking at. Do I want to go to a unit where I got to go through all of that, and maybe they may not train me as well? Or do I want to go to a unit where I know it's a great team, we work well together? Because that makes a really big difference, So it's kind of like that. I do plan to go to grad school. I already have my school in mind. I already have my degree that I want to take. The class I want to do. So I wanted to start really right after when I start my residency. One of my instructors told me it's extremely hard trying to learn the job and also try to do school. He was saying he suggests wait a year. So I may wait a year. It just depends on how I feel with the residency. If I'm comfortable and I feel like I can start taking some classes, I can, because I have an idea. I know where I want to go. I know the path that I want to go down as far as in my nursing career. Yes, I plan to do bedside for about maybe a good 5 years, maybe 6 years. But my goal is to have all my certifications, to have my master's before I'm 50. I have a birthday coming up in January. I'll be 46 years old. So I'm looking at about a good 4 years that I have until I'm done with that. I already know like I said, I already know the programs. I already looked at the classes and researched everything. The program I'm doing, I don't have any kind of clinicals or anything like that I have to go through, because my path is more dealing with leadership, quality management, risk management. That's kind of like the path I want to go down. And also education. I want to teach as well. So, who knows? I know your girl waited till she got older to do all this stuff, but, I guess it's better late than never. So, but yeah, actually, as you guys know, I bought another car. So I bought a car for my son. Really, the car that I purchased, the newer car, he pretty much driving that car. I got the older car. Because, these young kids nowadays, they don't know how to drive cars without the camera or anything. And I actually like this little car. I'm not going to lie. It has very good pickup speed. I never purchased this brand before. I've always been a Ford kind of girl. The newer car that I have bought was a 2020. It's a Ford. Like I said, my son likes that one because it has all the things that tells you if a car is on side of you, if a car jam on brakes, light flashes across the dashboard telling you to stop. It doesn't let you wander lanes unless you use your signal. It's cool. And I think I kind of got a little spoiled driving it too, because when I was driving this older car, bagging up, I'm waiting for it to say beep, and it's not beeping. I'm still back saying, hold on, let me stop before I want to hit somebody's car. But I don't know, I like it, But yeah, actually, my mechanic told me I made a great deal. This was a cash car that I purchased, and I bought it from my friends, one of my really good friends, her husband. And he was just saying, it was a good investment. He was telling me how, great the car is. There's some kind of, of course, if you got an older car, you're going to have little hiccups and things like that you got to fix. So my mechanic already told me things that we need to work on fixing. So I'm supposed to bring in the car to him so he can take care of some other minor things that I have to do. But I really do. I love where I am right now, Homework. I just been doing the damn thing. I'm not gonna lie to you. I thank God that, I have 2 cars. I don't have to worry about my son using Uber, or I have to use Uber. I'm just blessed the fact that I have 2 vehicles. I'm blessed that he knows how to drive, and I feel comfortable with him going on the road driving. I thank God for my tuition being paid in full. Because my goal was for my tuition to be paid in full before I start Med-Surg 3. Because everybody's talking about how Med-Surg 3 is a beast. You got to go in already like they talking to you like you're an actual nurse. Honestly, what they said, I didn't get that. I didn't get that at all. I actually like Med-Surg 3. So I like the fact that you have to really use your critical thinking skills. You have to really know what you're talking about. And it's so crazy because even with me sleeping, like I'm thinking about nursing stuff when I'm sleeping. I'm dreaming about what would you do if this is this, or this lab is this, or if patient come in with this, what would you do? And in my mind, I'm pulling things from what I've learned, what I would do. Even when the patients take medication, like one of my clinical instructors, she said, you should know why you're giving this patient this medication, and I'm understanding that. And even some of the things I'm learning didactics, where like I'm in clinicals yesterday, is like I understood when one lab was off and they gave medication, the lab still was off. I knew you had to check the other one or treat the other one before that one can actually improve. So it was like, I'm like, oh my God, I think I'm getting this. So I don't know. We'll see. My plan is for me to apply for all specialties. I'm going to apply for ED. I'm going to apply for ICU, CVICU, pre-op, surgery. I'm applying for everything. Well, I'm not going to apply for surgery because surgery is pretty much Monday through Friday. I don't want to work Monday through Friday. I do not want to work Monday through Friday. I want to work 3 days and be done. I want 4 days off. So if I want to work a second job, which you guys know, your girl like to have at least 2 jobs because I love my hands in everybody's pockets. So, excuse me. So my plan is to work, and I still wouldn't mind, you know, doing my adjusting thing, because that adjuster job was pretty, it was good. It was good money, good bonuses. You know, it was just good. It was a fun job. It was just that I couldn't handle doing that kind of work and doing nursing school at the same time. Because I thank God for that job too, because that job allowed me to be able to pay my tuition. As you guys don't know, I was paying a minimum of $2,000 a month for 3 years. Sometimes it was 22, sometimes it was 24, 26, pretty much 20. I paid one for 9 months. I paid about almost $2,700. It was really like $2,675. So you might as well say $2,700. Thank God I was able to pay those people all that money and still pass my classes and do well in school. So, you know, I ain't no punk now. You know, I'm stronger than what I think I am. But I mean, I'm getting it. People be like, you're not tired? No, I'm not tired. I'm good. You know, they don't make them like me anymore. Just like they don't make my mom and them, the baby boomers, like they make them. You know, I'm Gen X for life. Is that an X? Shit, who knows? I don't know how to do a damn X. But Gen X for life. So yeah, it's been a nice, good journey. I really enjoyed my nursing school journey. What else can I tell you guys? Told you a good bit about me. Son doing great. I'll be done early next year. So my son, he'll be getting his own place and he have his own car. I'm trying to get him to get a second little part-time gig or a little PRN gig, so he could be putting money away and saving money, because I'm ready to be an empty nester. I'm ready to live just me and my dog. Well, not my dog, my baby girl, because she is really like my daughter. That's my baby, Cricket. I wouldn't mind getting Coco back, but I did give Coco away. Coco was just too much for me, especially in nursing school. She was just too much. I couldn't handle her while in nursing school. But now that I'll be done, the hard part is out the way, I can actually get her and we'll be fine. You know, because she does enjoy being with me. Believe me, she does, because I spoil my animals. Shit, my son damn spoiled, even though he don't think he is, but he is. And they all bully me. He always mad at my dog because he say she always bullying. I'm like, shit, your ass bully me too. You know, you talking about her. Shoot, all y'all get to take advantage of me. But yeah, your girl is good. You know, life is good. I just can't believe I'm doing this. Like, your girl is about to be a freaking nurse soon. And I remember people was telling me, even I told myself, I'm not going to be no damn nurse, because I never liked to deal with the respiratory, like saliva, that stuff would, Now, I think after being in the field for so long, it doesn't bother me. Poop doesn't bother me. None of those gross things bother me anymore. You know, it's like I treat these people like they're my relatives. And I don't know if I don't know. Because believe me, I treat them like it's just all of them my family members when I have my patients, you know. I mean, I'm professional, but I show a lot of extra care towards them, you know. But anywho, who knows when I'll be able to come back on. And I'm actually just coming back from the store because I got to work tonight. And I want to take some Benadryl because I've been up really since 8:30 yesterday, last evening. I got out of clinic. Well, the day of my clinicals on Saturday, which was yesterday, I had to be at the site for 6 a.m. I woke up at 12:34, matter of fact, 1, 2, 3, 4. And I stayed up until I got out of clinicals. I went home and went to bed and I went to sleep. And I didn't get up till like 8:30 that evening. And I've been up since 8:30 last night. So, and I do have to work tonight, and I do have an assignment that I need to get completed by midnight tonight. The thing is, I need to do that assignment with a fresh brain, not exhausted, well rested. So that's why it hasn't gotten done yet, but I will get it done tonight because I am going to sleep this morning, and I will get it done tonight. But anyway, I'm about to cut this video short. So you guys tell me what you want to hear, see. I know I don't come on here as often. I've been wanting to make a video, and I'm actually, like I said, I just came from the store. I'm sitting in the car making a video, and I need to get out because I just brought a bag of ice and stuff. So, but anywho, let me guys know. Oh, if anybody know where can I go to get my continuing educations for my CRAT and my claims adjuster. I do have an idea where I can go for one of them, but I don't want to pay no $400 and $500 for no credit hours. I want the cheap way. Either if it could be free, a few dollars, I don't mind paying, but I'm looking to see where can I get my CEUs for my CRAT, which is my Certified Rhythm Analysis Technician certification, and also for my claims adjuster for Texas All Lines certification. So I've been asking people, but I really need to probably talk to them and ask them. I need them to show me a site because I know my license is coming up and it's going to be expiring by the end of this year or either January. I can't remember. But I want to go ahead and try to get them and knock them out and get them out the way. But anywho, it was nice talking to you guys. Your girl about to go. Yes, my hair needs to be done. I'm going to get it done before I start my capstone. I think I'm going to get it French braid because I need it to last longer. But yeah. But anywho, I'm going to put some Visine in these eyes to try to clear them up. Take me some Benadryl and go my to bed. But anywho, peace. I'm out. Love you. Holla.